Good evening. We are so glad that all of you have joined us tonight for our Day Family webinar. This is a continuation of our conversation a few weeks ago. We have lots of updates and new information about how school will look in the fall and things that you and your students need to know to have a successful entry back to school. So we have a very full panel this evening. We're pleased to have Dr. Chris Lewis, one of our parents, but also the VP of Medical Affairs at Centra, our local health system, with us tonight to give you some interesting insights about COVID and what he's seeing and his thoughts about our planning process here at VES. Chris Button, Amy Coleman, Garth is with us, Justine Button, and Mimi Chetlos is also on with us. So you have the majority of the team who can answer your questions here, and we look forward to sharing our information and then shifting to answering all of your questions. As I always like to share, we are filming this video so that we can share it as a replay later. So thanks. I will pass it to Garth to start us off.
Thanks, Catherine. And just thank you guys for joining us tonight. We're really excited to get started with this school year. And we hope that we will be as transparent as possible in terms of what we're doing. We think we've got a great plan. We're watching a lot of schools that are starting to open right now around the state. And so we'll be watching those closely. And so things could change as we learn from what other people are doing. But one of the great things about this team is they've been relentlessly focused on one thing. How do we prepare the campus so that we can open safe and effectively with students on campus on September 7th? And every time we've been presented with a challenge, we've found a solution. We've had great support from the board. We've had great support from the community, and we've had a lot of issues that other schools are facing in terms of faculty trepidation about being back on campus. I was just talking to Larissa and Jason Knable, and they understand that it's not going to be a perfect world that you step into on September 7th, that there will be some inconveniences, but they would take those over a virtual classroom any day of the week. And that's why they reminded me that they got into teaching, not to be in the virtual world, but to be with your kids in the classroom. And so I think that's always been sort of our attitude amongst the entire team here. And so we hopefully we'll be able to answer all of your questions tonight, but I imagine you're going to ask some things we haven't thought of, but just I hope you always know at VES, we want your voice heard. And so if you don't get your answers, don't be afraid to follow up and reach out and contact us. But again, thanks for being here. And I'm going to turn it over to the experts, starting with Chris Button.
Thank you, Garth, expert. I'm not sure if that's the one for me, but certainly the gentleman that I get the honor of introducing in a couple seconds. One of the things that I do want to just mention before I turn it over to Dr. Lewis is we always talk at VES about this concept of partners. When you went through orientation, you probably heard us say it, that this is a partnership. We are all in this together. And honestly, that word, I think you couldn't imagine a better word for what we need and what we're going to ask is an amazing partnership. In fact, that partnership is absolutely essential for us to both open well and then ultimately stay open well. And what we are going to be asking of every group within this community is an element of sacrifice, an element of inconvenience. And we're doing that with the basic premise that what's most important is that we deliver a top-notch academic program and that whenever possible, we are together as a community. From our day students to our boarding community, to our international students, to our faculty, to faculty, families, literally every part of our community is being asked to sacrifice something. And so with that, we understand in many times, or many cases, maybe that we're going to be asking maybe a little too much for a family in certain areas. And one of the things that we will talk about is the concept of choices, because we want people to feel comfortable with everything that we're doing and everything that we're asking, even though we know there'll be times where people aren't. And so there may be times where we say, you know, you have a choice. And so realize all of that comes from the basic premise, the essential responsibility of mitigating as much risk to this community as possible. And one thing we realized relatively early on is that if you look around the table, you'll see a lot of liberal arts majors at the leadership team, in the Open Well team. And actually it was Dr. Larissa Knabel that suggested maybe you need a science-based person on your team. And luckily Tommy Battle and Chris Lewis had connected earlier in the spring, and then Tommy passed that contact on to me. And so we were very fortunate to get Chris into the fold. He's volunteered tremendous amounts of time and wisdom, and from time to time, a little bit of psychological support for me as he talks me off an edge or a ledge here or there. But we're really happy to have Dr. Lewis, who is the Vice President for Medical Affairs at for Centra Health, a cardiologist, and probably most important, a father of two of our students, 2 day students. And so I turn it over to him for his words, and certainly it has been a soothing voice for all of us in our leadership team. So Chris, thank you, and you have the floor.
Sure, thanks. Thank you, Chris. Good evening, everybody. And Chris, to you and your team, I don't want to destabilize the situation, but you may not realize I was actually a philosophy major. So there's some liberal arts there too, but I am a doctor. I did all the science stuff too. So anyway, thank you all. Most importantly, yes, I am the father of Lily and Sierra, rising sophomore and junior, and Danielle is my wife. They're all sitting around the kitchen table in front of me. So they'll cut me off if I'm talking too long. So I was asked to talk about a few things. One is sort of how I got here, I guess, to talking to you all. And frankly, I've looked at the roles of who's here attendee-wise, and I recognize most of the names. And frankly, a lot of you are on the medical staff too, so you're sort of living this with me. But I was asked, so as Vice President of Medical Affairs, I've done that now for 2 years. Most recently, over the last several months, when COVID hit, Centra stood up the Incident Command Center, which is how we manage disasters. And usually that's a brief thing. The derecho comes and you're up for a few days and then stand it down. Well, COVID keeps going and going. So we've had that now for for months on end, since March. And on that panel, I serve as the medical and technical specialist. So what that had me do was I worked with things like PPE, with testing, protocols, procedures, just trying to figure out what the best thing to do is with COVID, because it is so new and everybody is learning. So we as Centra learned a lot. We're still continuing to learn, but we've come a long ways, I think, in terms of also being as safe as we can for our patients and certainly our caregivers as well. And so in that capacity, Andy Muller, actually our CEO, had asked me at one point, hey, Chris, we've learned a lot here. Could you maybe go out into the community and talk to some of these businesses and schools that are looking to, they're also trying to figure things out and they want to open up again. They want to open up their schools and whatnot. Would you mind talking to some of them and sharing what we knew? And I was happy to do that. So, one of the first folks, I was glad to connect with Tommy, who really did a huge job. Although I know he was outgoing, he knew his outgoing. He really threw himself into this because he knew he needed to make the school as safe as possible and make Garth's entry as smooth as possible. So I started talking with him some, and then, as Chris said, I connected with him. So that's how I'm here. expert, I don't know. I've dealt with this, unfortunately, a lot over the last several months. We're all becoming more expert, but there's a lot to still learn. So I'm happy to share what we know or what we think we know. So one of the first point that I was asked to talk about is sort of the state of COVID in Lynchburg and the area. And that's fairly important because it is the setting that VES is in. And it is the setting that day students and families are living in. Frankly, faculty, if they come off campus, and any boarders, if they come off campus, they will be within this community. And what's important to know is that COVID, it is here. It is what we call community spread at this point. Early on, our early cases here in Lynchburg really were more sort of very rare little pockets. We could really always trace, oh, somebody came visiting from abroad, that's what brought it here. Some of the congregate settings like nursing homes, yes, there'd be flare-ups there. At this point, it's really broken out way beyond that. That when in the hospital, we see patients, certainly from congregate settings like jails and nursing homes, but very much community members as well. And often we don't know exactly where they got it from. They don't know. They were out in the community. They tried to protect themselves, some better than others, but they got COVID, and some of them got sick enough to come into the hospital. So that's the key thing. It is out there. And frankly, at this point in the community, if we go out into the community, anybody we come in contact with could potentially have COVID. And so that's not to scare people. It's just to sort of say that's the reality right now. And that's how we need to be careful and be safe as possible, knowing that reality. So very briefly, also a little bit of the science about this, and again, philosophy major. I'm not going to go into the depths of science here, but it is important in terms of understanding why the safety behaviors that we do, certainly at Centra, we're asking for the community to do, and VES very much is going to be asking all of us to do. And it sort of bases the why of that. So this virus, from what we know so far, it's very good at what it does. It's ripped across the globe in the last 6 months or so in ways we haven't seen anything do in decades, frankly, century or so. It knows how to move from one person to another very well. It moves, as best we can tell, and we really think this is the majority of it, through droplets. So drops of water, basically, they're quite small, that one infected person will generally cough up, sneeze up, project outwards, and then it will contact somebody, another individual. And if it gets anywhere into the nose, mouth, we think also eyes, that can then get into the other person's respiratory tract and then start breathing, and they get sick. So that transmission is the key to figuring out the behaviors for safety, which if you look at the opening safely documents you've got, it really hammers that home. And that's why, 6 feet separation. There's nothing magic about 6 feet. It's just that the sort of rough estimate of how far the average person can cough or sneeze. I mean, I'm sure there's super sneezers out there that can project further than that, but it's roughly 6 feet or so. So that's the distance separation. That's the masking as well. And it's often it's sort of source control. So you have a mask on if you're sneezing, if you're coughing, if you're really expert getting stuff out of you, it should be shielded by that mask. There is also some emerging evidence that the mask may also protect you on the receiving end. It's not certainly 100% at all, but there is some level of protection probably there. And then also the hand washing. If you cough out stuff and it lands on a surface, we don't think it's the predominant way that things move around, but if somebody else contacts that surface and you take it up to your mouth or your eye, there is thought that it can transmit that way as well. And so that's why wash your hands frequently. We're cleaning surfaces frequently, and you'll see that in the opening plans as well. So that's sort of the science that drives the safety behaviors, and epidemiologically, we've seen that seems to work. Places and societies and pockets that do all of those behaviors seem to do much better in terms of transmission rates. So that's key, frankly, to the opening plan. The other piece that I was going to talk about a bit is the demographics, which to some extent is it's certainly in our kids' favor, right? I mean, it's about a lot about the kids. Kids are going to school. The demographics of can kids transmit and can they get sick as in infected as easily as the rest? We think probably, but what we do see very clearly is that this is a disease that really hurts us more the older we get. So as you go higher in your decades, it can become more serious. The rate of hospitalizations gets higher the older you go. The death rate significantly skews towards the last several decades of life, sort of 70s, 80s, 90s. Those are by the predominant deaths. But don't get me wrong, this can affect younger people too. Now, fortunately, in the first 2 decades, so up to 20 years of age, we don't see a whole lot of hospitalization at all. And death is very, very unusual, extremely unusual. So at Lynchburg General, the youngest patient we've had was 19. They came to the floor, we watched them, they did fine and went back out again. In terms of intubation and really sick, that's probably 24. But you also have to realize there are the risks with comorbidities. So if you have other underlying diseases, you certainly are more at risk as well. So the good news to some extent is that sort of healthy kids coming back to school, like predominantly most of our kid population going to VES, they will, even if they get it, they should be okay. They may feel sick, they may not feel it at all. They may have a little bit of sniffles and whatnot. And some of them can get kind of, pretty sick, not great at all, but needing hospitalization, that would be very unusual. The population, though, that as I talked to Chris about, that you do worry about in this setting is sort of frankly faculty and staff and people that are on campus to help, facilitate things, to make this work. They are sort of in, like myself, are in the upper decades of the higher decades and certainly the first 2. And so they become they're more like frontline workers then. They are putting themselves at risk in a job that they are serving in. And so, Chris and I talked a lot about making sure that those people are as safe as possible. And so safety behaviors of everybody, this is certainly kids have to do as well to protect everybody on campus, has to be done. And so along those lines, Chris also asked me, and he's a pretty sensitive guy. I didn't really appreciate that early on, or didn't understand it. I think it's because he talks so loud, and he's a lacrosse goalie in college. Those things I found out about him. But he actually, he did some soul searching about, do we really open up? Is it safe to do that? Is it frankly moral or okay to do that and bring people onto campus knowing that there is some risk? And I thought that was really, it's a great question, and I think very well worth thinking about. And, at the hospital, that never really was an issue, right? You don't close the hospital. You're open for business always. You have to, come what may. We are an essential function. So you just, at the hospital, look at, well, we're going to be open. What's the safest way to do it? And do that as best you can. Thinking about school and VES in particular, it to some extent, you can do online learning. And I think Garth was talking about, what the Knable said, well, we prefer not to do online learning. We want the real thing. I think that's the key. It's not just the learning, it's the experience of coming to campus, being together. It's more than just the education that kids get. It's the development. It's the, towards full stature. It's those pieces of VES that really, I would say in my mind, and I'm not the boss of this, but those are essential functions. And that is an essential function that VES produces. And so I think that, opening up is really, if you can do it as safely as possible, in my mind, I think that is a reasonable thing to do and the right thing to do. And I think Chris and frankly, the faculty and team all, I think, feel that way very strongly too. And clearly a lot of the parents do as well, because we're sending our kids there. That's what I want to do. That's what they need. So along those lines, so then it comes to, okay, you're going to open up, you're going to have people on campus. How do you want to do it? So if you're going to do if you want to get to zero risk, right? No risk, this is going to be okay. That's really not a very feasible stance. I mean, what you would do is you would get everybody clean coming in. So you would quarantine everybody, test everybody, bring everybody in that was going to be on campus, and then you would close the gates and shut the, have walls around you, and that's it. And that's not realistic. You can't do that, particularly, I think, given the VES, what it believes in and what it is a community that also exists within the larger community and has people coming and going, has day students coming and going. And that is sort of, I think VES said, yep, we've got to do that. We can't close our borders. Borders as in the walls. We need to continue to function like a real VES school. And so then you say, okay, so then it becomes we will accept some level of risk, but how do we make it as safe as possible? And so that is where the plan comes together that you all have seen, that continues. I'm sure you'll get more fleshed out, and as was mentioned, may change somewhat over time as we learn more and know more what's going on in the community. But it is a pretty robust plan to if you're going on the side of safety, it is erring really on the side of safety as hard as I think it can, just looking at it and reading through it. In terms of expectations of day students like my kids, and frankly me as a family member, that we have responsibilities to be as safe as possible. To when our kids come home and come back into the community, we need to make sure that we are constantly doing safety behaviors. Danielle and I have to do the same, because we need to be safe and not infect each other and then have our kids come onto campus. So there will be, limitations to what we can do in the interest of being able to live the VES life and have that continue on. Just along those lines, boarders are going to also have significant expectations in terms of how they behave on dorm, the amount that they can come off campus. It seems, as far as I can read initially in talking, that's going to be very minimized, and that's a sacrifice, but that's what it takes to make it work. Frankly, then also you have to figure out, well, once people come onto campus, if you can't guarantee COVID won't come on, what safety behaviors can you put in place and procedures and protocols to keep it from spreading as well as possible, to slow the spread, maybe even stop it completely? And that's part of the plan. And it calls for some pretty serious action and some serious changes from what we're used to with VES, but they're critical to being able to open safely. And then finally, you need to have a plan if you sense that COVID has come onto campus, how do you manage it? How do you figure out who has it? How do you quarantine them safely? How do you test? All of those pieces are part of the plan as well. And, frankly, I've seen different plans from different institutions, and, they're good. I think folks really put a lot of mindfulness into this. I would say VES has really put a tremendous amount of thought into it. And in terms of tight plans, this is really up there. And my hope is that at some point, I think all of our hope is that one will be able to relax it as we see that this works, as we see that maybe the spread isn't so bad in the community anymore, it's going down. You can relax, but I think that it makes perfect sense to me to be as tight to begin with, and then relax if things work, versus go in relaxed and sort of with less safety precautions, and then really have to clamp down if things start getting bad. So, that's my net. And final, I would say that the team that has been working for months on this plan and the thoughts of putting this together as safely as possible, really, you all have done a fantastic job, and hats off. And your interest of safety for everyone concerned, kids, faculty, frankly, parents as well, is amazing. So that I probably went over my time. Nobody gave me the sign to shut up. So I'll be happy I'll be on for questions later if I can help. But I guess, Chris, back to you, or Catherine, whoever wants to take it.
I'm going to take it. Chris, thank you so much. Your information, I think, is always enlightening and helps put great perspective on what we all need to do, and how this is really a community effort that everybody is going to need to buy into and keep each other as healthy as possible. Shifting gears, we're going to have Justine talk a little bit about the option to board. Some, some opportunity has arisen that allows us to offer space. And we will talk a little more thoroughly for anybody who's curious about how that day versus border dynamic is going to work. Amy Coleman will share a lot around that. But right now, Justine, why don't you walk us through the opportunity?
Yeah. Hi, everyone. So I think the email was sent out Tuesday, and basically, you know, I think we're all trying to find some positive in this chaos, and I think this is one of those opportunities. So we do have some different travel restrictions with our international students. Huge shout out and thank you to Esther Johnson and Trip Price, who have been working really hard with that group to, first of all, try to get them here. That's what we really want. But we are finding some students that have either opted out just for this first semester or truly cannot physically get here. And so with these beds on dorm open, you know, we talked as a senior leadership team and really thought this is a great opportunity for some day students to join our community. I think we've all, you know, been home with our kids, and I think our kids are ready for, you know, this community to jump in. And I think, as Chris said, you know, faculty and staff really are. I think, Dr. Lewis, thanks for all of your words, but I think, you know, we feel excited, and I think seeing your kids is just going to bring so much joy. So we've asked that if your child does have an interest in joining the boarding community, to let our team, our admission team, know directly by this Monday. I've had a lot of interest, texts and phone calls and emails, and we will, my husband and I were out of the office, but I'm back tomorrow, so I'll be getting back to you if I haven't. But our group is going to gather those names, and then on Monday really try to give you all some perspective of how much space we have. Ideally, it would be wonderful to grant everybody a bed, but we don't know at this point just because of the travel restrictions and which kids can come here. So what we are asking is by Monday, if your child and your family are interested in this opportunity, let us know so we can have them on our list. And then from there, we'll be communicating. And if your child does decide to be a boarder, we will personally communicate with you about rooming options and just how that whole process will work going forward. So they will be a part of our boarding community for that first 10-week period. And they will be on campus. They will not be allowed to come and go. So that is part of that boarding community that I'm sure Chris and Amy are going to speak a little bit more about. So we're really thrilled for this opportunity, and I think it's going to be a great one. And as I said, we've had a lot of interest, so we're thrilled.
Fantastic. So let's shift over to Mimi. And she's going to give you an update on academics, what the daily schedule will look like, just a lot of those questions that we now have really good answers for. All right, Mimi?
Yes, and Darko, if you have that, you're just one step ahead of me always. So I hope you have all been checking out our opening well page on our website. If you go to the menu, it's the first link on there. And if you look today, you would have found this new beautiful schedule posted that reflects what a week in the life in the fall semester at VES will be like. Those of you who were on the last call like this might remember my impromptu illustration, but this is what it was supposed to look like. So while it is pretty self-explanatory, I think I want to just walk you through a couple of the most distinctive elements here. And regarding arriving on campus and departing from campus, I know that Amy Coleman will speak to that in a bit. So I'll just jump in. At 9 o'clock, the start of the academic day. Again, we have 3 periods that will be meeting in person each class day. And I loved what Chris Lewis said about, you know, what is so important, I think, this semester is that feeling of coming together and being together after a time apart. And that is really what our faculty are going to be stressing in those in-person classes. So you can see Every class period is 70 minutes long, so that's just about 10 minutes longer on average than most of our class periods in previous years. We have this nice long mid-morning break to help students travel efficiently and in a way that mitigates risk from class to class, and having some time to chat along the way too, I'm sure. Our next period is 10:30 to 11:40. And then we have this nice long lunch block in the middle, which will allow students to get their meals in a physically distanced manner, and then use a lot of that extra time to meet with teachers, work on group projects, and also to engage in student life sessions, which each student will have once a week. And there may be more on that in a bit. Then we have our final period of the day from 1:40 to 2:50. And the collaboration period that happens on Monday through Thursday is another time for students to connect with teachers, work in groups, and that is also when our advisory meetings will be happening. So I hope you can see through this schedule that emphasis on slowing down, mitigating risk, but really maximizing our time to connect with students and for students to connect with one another. There is an evening study hall also for boarding students. It's about the same length as it's been in the past. So I'm working on a couple of short videos that will be posted on the Opening Well page too. One which will give you a snapshot of what an on-campus page will look like. And remember, on-campus is our learning management system that we use, and those returning families know that's how you've checked grades and progress reports in the past. But all of the content for our courses will be provided on those on-campus pages, because just as Justine said, we know at this point we will have international students who will have to complete school virtually through the entirety of the fall semester. So we're doing our best to design a meaningful educational program for students who are here on campus and those who want to be with us so badly but cannot be with us. And we also know that there will be times in the semester when, perhaps there's a family emergency or an illness or a special event that your students absolutely cannot miss. And when they go to that special event, they may need to complete virtual school for the 2 weeks following. So our academic program will be designed so those students who are working from home absolutely will not get behind. They'll be able to connect synchronously to the class day from home, and our faculty are working so hard to find really great methods to do that. I think we mentioned last time that we designed our professional development for faculty so that it models the type of classes that they will be building for their students. And so far, they've said that's been very helpful. It will look very different from last spring. There's a lot more structure. I think it will be much easier for our students to navigate their classes, and they will absolutely know what to expect from week to week in each of their courses. So I'm more than happy to answer more questions later, but I hope this very well designed visual helps you out. And Darko, can you just scroll down a bit, because there's some other information I think below. Yes. So the one thing I did want to point out was, you can see on this visual, we start with a period. The period that starts the week will be different each week, so that we make sure all of the 7 class periods in our rotation hit that first period, which will be easiest for our international students to connect synchronously. So the schedule will rotate like it always has. The start with A on this document is just to help give you a sense of what the first week will be like. And this is the schedule exactly for the first week. I think that's all for me for now. So Amy Coleman, I know, is gonna fill in some of the other pieces there.
Hello, everyone. Thank you for joining us tonight. I have a 7-point agenda to get through on my own, so bear with me, please. So the big news for day families, for new students, is that the orientation team has decided to give our new students special attention and move the day student orientation away from September 6th. So you can take that off of your calendar. It is no longer on September 6th. I'm about to contradict myself, so pay attention. We are going to have a special orientation for day students that invites each and every one of you to campus on your own. I mean, mom or dad can drive you over, and you're going to come onto campus and you're going to kind of get a feeling for what it's going to be like to come to school every day. And that means your mom or dad will drive you onto campus. You'll go through the health screening that you'll have every morning before school. And then a member of our team will escort just the student onto campus to show you where the day student lounge will be this year, and to then show you where your first period class will be. We'll also walk you through from outside the dining hall, sort of, you know, because all kids want to know about when's the food and where can I get it. So we're going to show you, kind of run through the lunch situation that's going to happen at school this year. And then we're going to take you back to your car. It's going to be, and you're going to get your books from the bookstore too. We'll have those ready for you to pick up. So it's going to take about 30 minutes, and it's just, again, going to be mom or dad driving you in, and then we're going to take you alone just across campus and back, just to orient you. We hope that makes you feel a little bit calmer on that first day of school, and that's the intention there. Now,
Amy, I'm going to jump in. Just to clarify, that's for new day students, correct?
New day students, yep. New day students, yep. So, and then, so that's going to take place the week of August 31st to September 3rd. And you're going to get an email from Esther Johnson, who will ask you to sign up for a time for that. So you're going to get to pick a time to come to campus and do that. And again, mom and dad, it has to be for just the student to go onto campus, because the second point in my agenda is we do ask all families to quarantine from August 24th to September 6th. And we are aware that we're asking, like, wait a second, I'm coming out of quarantine and coming to campus. But we feel really strongly that building that confidence prior to the first day of school is important. And we feel like we're doing it safely. If you come to campus, you're obviously wearing a mask, you're going through a health screening. We're going to keep physical distance between us as we walk you around campus for a few minutes and get your books and send you on your way. Quarantining from August 24th to September 6th. You know, we ask everybody to take that very seriously. That's the big one right there. That's how we're going to open well and stay open well, if everybody abides by the rules of quarantine. And if you have any questions about those rules, there's, you know, plenty of resources that we have already given you and will continue to give you about what the definition of quarantine is, should you need it. I'm going to pause in my agenda and hand 1 point over to Chris Button. It is about COVID testing. I think you asked to take this one, Chris.
Yeah, so there was also a question in the chat about if we're, you know, if we can test, why quarantine? And the only way for testing to be effective is to quarantine and then do the test. So we are asking that every VES student try to obtain a COVID-19 PCR nasal test after September 2nd. And while this provides a little bit of assurance, it really is dependent on once you have that test, really going into a pretty serious lockdown after the test is taken. We also know that supply chains and all the issues that we've had with testing may make it so we're unable to do that. That's our hope right now. We have partnered with a company to help facilitate that. It's like a concierge testing company that will help us connect with labs that have availability and have resources. But what we would ask is that families look into the availability of testing after September 2nd. And if you find that it's going to be really difficult to get that and to be able to get that result back by the 7th or ideally the 6th, we can assist you in that process and are happy to do so. And through this, we may find that is not going to be a possibility. And if that is what we find, that's another reason for a really effective quarantine, as there have been several schools that have opened and they have opened with quarantine only. And there are schools that are actually doing quarantine in dorm rooms and not allowing those kids to leave their dorm rooms for 14 days. And we felt very strongly that the healthiest thing for our kids would be to be at home during quarantine. But it is essential that we have your support and buy-in on this. And then the testing, we're going to do whatever we can to make that happen. But we're going to need a little bit of help, and hopefully we'll be able to make that a reality. So thank you. Back to you, Amy.
Okay, thanks, Chris. So yeah, and I'd like to add to that, I hope we can get testing, and I hope if we are lucky enough to get testing, that everybody did a clean quarantine, because I don't want anybody to test negative. Even those people who are saying, oh, I tested, or test positive rather, I want everybody to test negative. It's truly inconvenient for a young person who feels totally well, who wants desperately to go back to school and be with their friends, to get a positive COVID test and have to stay home for a while. They want to come back to school. We want them back to school. So that clean quarantine is the best way to do it. So I'm really rooting for that. Point 4 tonight from me is you guys will be asked to sign a pledge that it's a commitment to each other. And please read it carefully, and more importantly, take it to heart. Signing a pledge means that we are committed to each other. We commit to the practices that reduce the spread of COVID-19 while on campus and at home. The at-home part might be difficult for some of us, but we really are asking you to make a commitment to practice, risk mitigation measures at school and at home. I won't go over every point in that tonight. It's not too long, but it's a little bit long. But I do ask that we all comport ourselves with the most vulnerable in our community at mind and at heart every day. That's how I'm going to comport myself. I'm going to protect the most vulnerable person on campus from me by wearing a mask, keeping 6 feet of distance, and washing my hands a lot. And I'll be reminding you to do that too, not to scold you, but to remind you to be good to the people around you. It shows that you care about everybody on campus. In one of the communications that will be coming out, and I forget what day, Catherine, but
well, it's on the website now.
Okay, good.
Yep.
So the next thing I want to talk about and ask you to read is we tried to put a handy tool in there and it asks you to truly understand the definitions of risk, essential and non-essential activities. And then it provides a chart that allows you to, if you're trying to figure out, I want to do an activity this weekend and I don't know if it's essential, non-essential, what kind of risk it is. Well, we've given you that information. And there's a quadrant provided in the communication, and it basically allows you to plot which quadrant your activity falls under. If it's a high essential, it's a very essential, like I have to go out and get food for my family, and it's low risk. High essential, low risk means go right ahead and do it. But if it's non-essential and high risk, it means you're not doing that activity. Obviously, those are the most simplistic examples. The communication that's on the website explains exactly, many, many activities, and it allows you, it's a simple tool that guides you in making the best decision for our community. The next point I'd like to bring up is, and describe for you, is what it will be like when you arrive at school each day. You will arrive to the King parking lot, and right outside of Van Every Center, you'll get your health screening every day. And basically, you will have your temperature taken, and you'll be asked some very quick questions about, have you been around anybody with COVID? Do you have any symptoms? It'll be very quick. We do anticipate that it'll take a little bit longer that first week of school. So the time window will be a little bit wider the first week of school, so we can get our timing down. And we expect that by the second and third weeks of school, we should all, have the ebb and flow, and it'll go a little bit more quickly. But let's anticipate that first week and make sure that we're giving plenty of time. And we will communicate to families the exact times that we want you to come to campus. And then in the afternoons, we're telling families that you may leave school at the end of your last obligation for the day. So where you are supposed to be, once that is over, and that could be class, it could be a meeting, with a teacher, it could be a club meeting after school, it could be sports. Once your last obligation is over for the day, you may go home. Now, if you're leaving campus, and we'll go over this, more specifically when we get closer to school, that first week of school, we'll ask that if you're leaving campus, that you go and sign out with an adult on campus to say, I'm going home now. And so the student life office will be able to sign you out of boarding wear. We need to do that to make sure we know who's on campus, because those are the people that we are 100% responsible for. And so we know when you've left campus, your parents are responsible for you then. It's super serious, and we really need you to remember to sign out with a member of the student life office so we can say you've gone home. And then we do want to tell you, assure you that while for the first 3 weeks or so, we're going to have to limit the crossing onto and off of campus. Again, the definition of risk isn't that we're going to be, we're not trying for 100%, stopping of the crossing over or stopping of all harm. The definition of risk is reducing the possibility of harm. So we take very seriously that we, as Dr. Lewis said, we can't 100%, it's not a prudent goal to say we can 100% stop all harm from coming to anybody. I can't control all of that. I don't know where everybody is in the community, but I can certainly do my best to, and we all will, to reduce the risk of something bad happening. And so that means for the first 3 weeks or so, we need to be really, really vigilant about the reduction of crossing onto and off of campus. After that, we do hope to offer more and more opportunities for day families to come onto campus on the weekends. We will not be doing indoor activities when you come into campus on the weekend, but Esther Johnson, who is, and the whole faculty actually, is putting in creative, wonderful ideas right now for outdoor activities. I think Ms. Chutlow said today she can't wait to play badminton and croquet. I did hear that earlier today from her. I heard Mr. Rem is playing tennis a lot lately. I said to Mr. Button, maybe we should have pickleball courts, painted onto that. So we are really, really excited to create fun outdoor activities. And we're going to put them on as soon as we feel like the community has internalized the habits required for risk mitigation of the spread of COVID-19, and that we can facilitate as safe as possible activities on campus on the weekend. So we are going to need you to be patient for a few weeks, but there will be fun and joy. Do not worry. And
real quick, just on that, I think it's really important just to echo, there really are two separate plans that we are going to be executing. There is the open well plan, which is really about the first 2 to 3 weeks. And then there's the stay open well plan. As we see how things go and we understand where our gaps are, we understand we're going a little bit overboard on this side. I like to call it productive paranoia. But when you get to those spaces, we realize that we can step back from some of those things. And that is our hope. And our other hope is that the testing capabilities are going to change or be at a level that if you do have to do something essential or non-essential that's high risk and it requires currently a 14-day quarantine, if we can get that quarantine time down through testing, we're going to do that, but we can't make those promises right now. And so we have open well and then stay open well. And the stay open well is going to be about trying to find more ways to engage, find out the ways that we can step back from the restrictive nature of the beginning.
And I'll say that, we all know that, they say a habit takes 21 days. And the feedback I'm getting from schools that have already started and been back to school for 2 or 3 weeks, in meetings and what have you, they're saying it takes about 3 weeks to get truly so you don't even realize you're wearing the mask anymore. And I don't take lightly that might feel like a long 3 weeks to some of us. And we're going to be cheering you on, and we're going to be saying we can do it. And I hope you say it back to me when I say this thing is so hot. It's just going to be, I think, from everything I'm hearing, it's just a little uncomfortable for 3 weeks or so, and then we get used to it slowly but surely. And like Mr. Button said, we really want to stay open. That's the goal, and that's what has kept all of us going as we've spent months and months planning for this day. We cannot wait. So that's it from me. I think I pass it over to Catherine again.
Yeah.
Thanks, everybody.
Thank you, Amy. So one thing I do want to share is that as of last night, we have put a tremendous amount of information that wasn't there before in the Q&A on our Opening Well website. So please, after this, take the time to really read it from top to bottom. The initial components are for everyone, and then there's a day student specific section that tries to address some of the questions that I know are on your minds. So just please know that's out there. And if you get there and you say, you know what, you didn't answer that question I really wanted to know, just shoot me an email or anyone on the team, and we'll make sure we get an answer out there for everyone to see. Some questions have come in advance of tonight, and also a few as we've been chatting. If you have questions you'd like to add, please do, but I'm going to start with the list that I've been pulling together here. So back to the idea of quarantining. I'm going to ask these three together because I think you can just sort of pull the answers into one bundle. Are we asking parents to quarantine as well? And do the families, the day families, have to really sort of continue quarantining because we're coming and going, right, from school? And so do we need to continue that sort of quarantine mentality even after September 6th? And then what if you have a medical visit during quarantine?
I can take some of that. Would you like me to?
Please.
So I like what TABS said. TABS is the Association of Boarding Schools, and the way they describe it is asking us all to live a quiet life at home. So, by all means, the whole family can look at the essential versus non-essential, high risk versus low risk quadrant that we've provided. And yes, we certainly do ask that you help your student go to school as safely as possible and maintain the health and safety of our community. There are essential, things that we all have to do. We have to go to the store and get food for our family. We have to go to work. And so we ask that when you're doing there, you're using to the highest degree possible safety measures. That helps us. So we do understand that there are essential things that we all have to do. I strike that against, when we can, let's live a quiet life at home until this crisis hopefully goes away.
Great. Another one of those questions is following your conversation, Amy, about how our day families are going to come drop the child off or the student off, and they'll have their health check and that sort of thing. Are we doing the same for staff who live off campus and any visitors, adult visitors that may need to come onto campus? How are we ensuring that we're doing health checks for them as well?
So everybody that comes onto our campus has a health screening, and it has to be every single time we come on campus. And our faculty and staff will be using a separate system, but they will be reporting every day their temperature, and they'll be asked online a series of questions about symptoms. Everybody will be asked a couple of different questions on Mondays or at the start of the week because of what might have occurred over the weekend. So we feel it's our responsibility to say, did you travel anywhere or did you invite anybody into your home from other places? Just a little bit different when there's a wider window and things could have happened over the weekend. But by and large, everybody's having the same questions. It's just different formats. The faculty and staff will have one format, and the student format will be overseen by adults on campus. Myself, Mr. Urick, and 4 other adults are going to oversee the student check-in every day.
Catherine, I'm going to add on to that a little bit. So one of the most important things that we can do, especially with the adults that are not working directly with students. So if you are a member of the staff here that doesn't work directly with students, you will literally not have interaction with students. Meriwether Godsey, our SSC, which is our maintenance and housekeeping, we are arranging all their schedules so they will have little to no contact with our students or with our faculty and staff. In other words, again, mitigating those risks. Anybody visiting campus must come to Front Jet. They must go through a temperature screen and a health check. And honestly, we are not allowing visitors to campus unless with day parents. We put it in there that you would need an appointment and we would know a specific time. We're actually asking this of our boarding parents as well. This is 10 weeks on campus, and parents, when we get to the point where we're able to have boarding parents visit their kids, we're going to be, putting that into a protocol. So that's a little bit on top of not just the adults that work within the community, but any adult, anybody that is not essentially working with students, there's not going to be interaction with those students.
Thanks, Chris. One of the questions is really very simple about, how early can day students arrive on campus? And we have addressed that in the Q&A. So for 9 o'clock start times, you heard Amy say a little bit earlier that the very first week, we would like you to come a little bit earlier than the rest of the time, because we want to get our processes down pat and move things seamlessly through. So you'll see the answer to that on the Q&A, but for 9 o'clock start time for the first week, we're going to ask that you come no earlier than 7:45 and no later than 8:30. And that will give us a little bit of buffer to ensure that students can get to class on time. After that first week, we would say really no earlier than about 8:15 and no later than 8:45. I have not actually put an adjustment to that for the 9:45 Wednesday start. So Amy, you want to tell us what you think?
I think at 9 o'clock is good for the 9:45 start. Yep, I think that's good, 9 o'clock.
Great, thank you. And another question is, when will the returning day students get their first introduction to returning to school and getting their books and that sort of thing? And I'll do just a real quick stab at an answer to that, and then Amy, you can weigh in as well. But we are producing some videos right now with the desire to help give those, particularly those who are familiar with the campus already, will quickly see what we're sharing and understand the changes that we've made. But this hopefully will also be helpful for our new students. But really introducing to them and to you, the parents, what we have done on campus to make changes to the classroom spaces and the, how we're serving meals and all of that. So we're going to do sort of an educational series of videos that are short and interesting, and we'll start dripping those out as students begin their first week of quarantine.
Yep. And that's going to shed a lot of light on what's coming up for all students on campus, especially returning students who are used to seeing VES look one way. It's going to look different when you get to campus. And we want these videos to make you smile, also to quell any anxiety you might have. The first week of school, so we're aware that we're having these little unique and special orientation sessions this year that won't be like any other year. We're taking that into consideration, and by the first week of school, we didn't put student life in the big period in the middle of the day, so that we could allow time for students to have orientation during that entire week during the middle of the day. So answer your books, that's probably, you're going to get those when you come to campus, but because we're not inviting students to campus prior to like that week before, except our new students who are coming to have their orientation. So again, that whole first week, we're hard at work right now programming everything that we would have put in a longer, more robust orientation weekend. We're programming it in the middle of the day that first week of school. I hope that helps.
Great, thank you. Let's shift to some testing questions. Chris, I'm going to throw these your way. Gotta find it, sorry. Okay, what are your plans regarding COVID testing for students and staff? So we've addressed the student component that's starting September 2nd or after September 2nd. All families will try to get that test for their students. What about staff? Are they being asked, staff, faculty, to do the same?
They are not being asked to be tested. They are asked to quarantine fully. Their quarantine actually starts this Monday. And so if we have availability for testing and faculty member would like to be tested, we will certainly test them.
And are boarders being tested upon arrival?
No, boarders are under the same testing protocol as day students. In other words, they have to have, we're asking that the test is completed after the 2nd, and then it goes from quarantine to really you're staying at home and you're limiting outside guests, really limiting activities to those that are absolutely essential after you take the test.
And will there be a lag time between when boarders come and the start of school to allow for any quarantining that may need to occur?
Our quarantining is, Amy, you can answer this as well, but what I said earlier is our quarantining is being done at home. We do not feel that it is healthy for kids to spend 14 days in a dorm room. And in fact, it's not an effective quarantine method given the availability of bathrooms and things like that. And so we are asking that the quarantine happen at home, the test, and then into campus.
And a little bit on that same vein, how many international families will be returning, and how are we mitigating the exposure that they may have had in their travel to the rest of the community?
Correct. So we've got, I think, and Amy, correct me if I'm wrong, the latest update, about 17 to 20 international students, that's a guesstimate, that are returning. And honestly, they're returning from countries in most cases that are having a much more effective go at COVID. They are quarantining for 14 days at home. They must arrive at wherever they're flying out of with the same negative test. They will then do a quarantine on our campus long before any other students arrive. They will also be tested during that, I think it's 6 days into the quarantine to make sure that they're clean. So we have really all in, they're looking at a 21-day quarantine with 2 tests. And so we feel that is as effective risk mitigation as we can do while still being, I think, mindful of mental health and of social isolation for those students. We have international students coming from other countries that are currently quarantining in a third country for 14 days, and their quarantine extremely long and very difficult to do. And they too have been tested, will test again, and likely be tested one more time after their travels. So it's a pretty expansive effort.
And Mr. Tripp Price is reporting we have for sure 15 international students today, and 4 are highly likely at this writing.
And just to finish on the testing front, will we do any random testing throughout the year?
We will not at this point, but we will obviously test if there are symptoms. Really, the ability to test is one of these things that the availability, and certainly Dr. Lewis could speak to the difficulty of acquiring, the expense related to testing. And talk to Dr. Foster, Matt Foster, who's also working with us. Our hope is that testing will become more effective, it will become more available, and thus we can adjust some of the protocols that are really, saying, testing is sort of a luxury that we all don't have. And we're trying to make it the most effective as we can with its availability. And Chris, I don't know if you want to comment on testing. I think it might be good to hear from the scientist.
So Chris, I mean, you're absolutely right. Testing from the very beginning has been a huge challenge. I mean, we thought PPE was bad. Testing continues to be and continues to evolve. From the very beginning of this, initially the hospital didn't have any testing for this disease. And so we were almost sort of running blind. And if we'd gotten COVID patients in our hospital, we wouldn't even been able to tell whether they were COVID or not. But it's really evolved over time. It has to do with how the pandemic is doing nationally. When different states light up, a huge amount of testing surge happens and it gets sent to the national testing centers, and their turnaround times get horrible. The science of testing continues to evolve, and there are new tests coming down the pike. Antigen testing looks promising, which looks like it's going to be a good point of care test for folks who are symptomatic. That's going to be part of the armamentarium. I mean, the longer this goes on, the more weapons we'll have, and the tests are going to get better. So I think Chris is absolutely right. We plan for a certain stance right now, but that could change. A month from now, the landscape could look actually quite different. So it's just reacting to those realities. So these are preliminary plans, and then you adjust. So hospital has to do exactly the same thing, frankly.
So another question has come in on testing about, what does happen? What are our plans if several students test positive a few weeks into school?
Amy, do you want to take that one?
I can take the one. I thought there was one, if one student tests positive.
Several students test positive.
Several students test
one
positive.
and several.
Okay, so if one student tests, first of all, let me back up to our nurses are well equipped and ready for whatever, asking and being vigilant about, if students have symptoms, they will get tested, referred for testing. But if they're asymptomatic and just worried, they're not going to necessarily be sent for testing. The nurses are well aware of the wider issue on testing in the Lynchburg community. And so they're very, very experienced professionals who are going to be careful about making sure that when a test is warranted, it happens. And when, calming nerves and anxieties is required, that happens. So that being said, say we have a student who does have symptoms, they will be sent for a COVID test. If they are a boarding student, domestic boarder, we'll use a multiplier of 4. That's what I'm thinking. We use a multiplier of 4, meaning if it's a domestic boarder who lives 2 hours away, we will multiply by 4 and ask those families to get here within 8 hours and pick their student up. So those boarding students who live 2 hours away, 4 hours away, 6 hours away, 8 hours away, multiply by 4, those families, they've already been asked to supply us with a plan to come collect their child should their child be positive or test positive. In the meantime, between the positive test and the time the boarding student can be collected by their parents, we will put the student in isolation until the parent can get there, isolated from the rest of the community. That's the beauty in building the wonderful new health center that we're building. We will have isolation space in there. And because we do have some extra spaces on campus in Third Jet, we have extra isolation space up there. So say a student just has a sore throat, but could really, you know, is otherwise fine. We get them tested. They have a sore throat and a fever. So we go get them tested. Oops, it's positive. But otherwise, maybe even the next day they're feeling okay, which happens sometimes with this. We still have to isolate them. They still have to be taken off campus by their parents. If it's a day student, we will be calling you to collect your student, obviously, and we'll be asking them to isolate at home until they're feeling better. If honestly, today, I don't want to say, I'm not going to pretend to have a crystal ball in terms of the exact number. So the word several has me, you know, tripped up a little bit because I don't want to say today a magic number is going to make us shut down campus, scrub everything, or shut down for the term, because I don't know that number right now. But I do know in the moment, 2 students or 1 student test positive or 2 students test positive, the leadership team is going to come together immediately, refer to Chris Lewis, refer to the VDH, refer to the CDC, and get our best guidance and go from there. And it will always be with the intention of safeguarding our community. I hope that's a sufficient answer.
Amy, could you just a little bit on the other part of that would be the contact tracing and what we're doing in classrooms around campus, so we
Sure.
do that effectively within the student body.
Sure, and that also loops in the question I saw, these old eyes saw somewhere in there about lunch. So, so basically, we have our campus you're going to come to campus and it's like signage everywhere about which spaces are safe to sit in, which space, the maximum occupancy for each space. It's all been measured out with best practices, measurements, et cetera. So this is going to, one of the measures that we've already referred to in an earlier webinar is there will be seating charts and in classes, and there will be seating charts in the dining hall. And that's not, and the seating charts will include putting day students on one side of the room and boarding students on the other side of the room. That's not to say, somebody asked me recently, does that mean that day students can't even hang around with boarding students on box? No, that doesn't mean that. This harkens back to the idea of mitigating risk. We know we cannot 100% of the time keep students away from each other, nor do we want to. But where it's appropriate and we can, and it won't impede learning and it won't impede joy, we're going to separate them. We also do this in the event that contact tracing takes place, so which it should. So that means that if a student from Mississippi tests positive and a day student family says, oh my gosh, my son is in that class with that student from Mississippi who's on his way back to his home. Oh my gosh, is my student, you know, testing positive? We're going to be able to say and reassure you that your student had one class with that student and they sat a catty corner across the room, for example. And by the way, they didn't eat at the same lunch period. And by the way, they didn't have student life together. So they sat across the room from each other in biology, and they had intramural soccer together yesterday afternoon. You know, so the minute a student tests positive, we go into on-campus contact tracing. We also have our on-campus. We're using the platforms to the best of their capability to help our contact tracing ability, and that includes boarding wear and on campus and our Magnus Health. So I hope that helps.
Great, thank you, Amy. Just to continue on that line a little bit further, and you know, Mimi, feel free to jump in here as well, Chris, Amy. But one of the parents has asked, can you refresh us about how the day and boarding students will be separated? So maybe you mentioned lunch and classes. Maybe can you talk through a few other scenarios? And then the DSL versus, maybe the border lounge areas. And along that same lines is, will they only intermingle in classes and in after-school sports? So if you can kind of bundle that and address it, that'd be great.
Chris, you want to take some of that?
Yeah. So one of the goals of campus movement classrooms, all of these places, is to mitigate risk through physical distancing and wearing masks. Our hope is that if we were to have a positive case, that if we're doing, especially within the day community, if we were to have a positive case, the on-campus potential for spread would be mitigated immensely simply by the practices and the hope and honestly the confidence that our students and faculty will be doing those best practices, even when we are not, for the students, when we're not there. And so that's the bottom line. All the work that we're doing, all the infrastructure, the tents, the outdoor classes, the indoor classes are really around making maximum physical distancing possible to mitigate the potential for spread, for campus spread. With that being said, Amy has brought up this concept that we do want these kids intermixing. We do want downtime. We want joy. We want these places on campus. Campus will be broken down between red, yellow, and green spaces. Red zone spaces will have very specific restrictions. In other words, dorms are a red zone. The only people allowed on those dorms are dorm faculty and the residents of those dorms. And that's because that is an area where air is likely to be shared. Simply because of the proximity of where the kids that live in that community or in that dorm. The dining hall is a red zone. In other words, it's a place where there's going to be multiple people in multiple time, and so day students are going to be certainly allowed in that dining hall, but the risk mitigation efforts outside of that are going to be stronger. So when there's downtime, when there's free time, there will be areas of campus where boarders and day students will be able to socialize and be together, but risk mitigation is going to be at a higher level because of that crossover. And so again, one of the things that it's a rule, this campus movement and all that is my area. We're going to have chairs. I literally just purchased 50 more beautiful white Adirondack chairs that I'm going to drive a truck to North Carolina and pick up. And if you know our campus, we have these chairs everywhere. They are going to be placed in certain areas, and our kids love to move them, but not this year. There is no moving of the chairs. Period. They literally, if they want to redesign, they're going to have to come to me and say, Mr. Button, I would really like to redesign this social space for A, B, and C. And then I'm going to go down there, and with my productive paranoia, I'm going to take my tape measure and 10 feet apart from each other and place these wonderful chairs all over that, so those kids can have that interaction, but ultimately mitigating that risk. And part of the risk mitigation is, if we do have a COVID positive test, that the ability for that to spread, especially in that outdoor when our boarders and day students are mixing, is going to be really low. And that's what we want to accomplish. I hope that answers the question. A little probably too much.
Thanks. A really important question here about how can VES help families, or what suggestions can we offer for families whose child or the children are non-symptomatic and they need to get a COVID test. So what's the best way to go about that?
Yeah. So Catherine, do you want me to jump in?
Please,
so
yes. Mm-hmm.
That also is very evolving. So the community, commercial places have started offering testing. Walmart and CVS does in select locations. The challenge with that is that the turnaround times for those is also very variable. And right now, current state, it's pretty long. And so it would fall probably outside that window of what you're looking for. So we would have to adjust out of the window or figure out something different. I think what would probably be best if we can, I can help continue to get VES, the catalog, or sort of the places where this could get accomplished. And, you know, hopefully the turnaround windows will be acceptable. But again, this is evolving and it could change within the next week or two even. So there will be some commercial places. You generally can go to a doctor's office, get a prescription for it, go to one of the urgent care centers as well, but that's a bit more clunky. Turnaround times usually will probably be faster for that. But you know, I'm glad to help with that and get some resources for you, because it's true that if we as VES, or you as VES, I guess, or we are asking for the testing, we should probably do our best to facilitate that, and at least give the information out where it can be done. And frankly, if it can't be done locally because all the turnaround times are horrible, if we have that capability at VES with your concierge service, those are higher price, but certainly that might be the only way to do it. But we'll help out with that.
Great, thank you, Chris. And as soon as you have some resources identified, we'll put those out on the website. A couple of sports questions. One, will the weight room be open for students? Chris,
so it's the weight room. If you look at the risk map, going to the gym is one of the highest risks in there. And so for just straight risk mitigation, we are going to begin the year with the weight room, the indoor weight room facility closed. Our strength and conditioning coach is working on a pretty robust outdoor-based strength and conditioning program, as all of our teams will be outside in the fall. So weight room will not be open, and certainly right now the plan is for the fall. But if we develop better plans and things like that, we may be able to open that at specific times. But I wouldn't plan on it.
So the other, and Casey, if I'm not representing this correctly, please type back in there. But the question is, what is the request for sports outside of VES? So for instance, if you're a dancer or you ride a horse, or what do you need to do?
Yeah, so this is a big one, and we're still working through it in a couple of areas. The basic premise that we're working on is the more contacts you have in the community with community spread, the higher the risk. And so if you are going to do something like go ride a horse by yourself or with a trainer, that represents a pretty low risk. If you are going to a class that there's 24 or 30 other people in that are not VES students and are not living by the same levels of risk mitigation that we're asking all of our constituents to live by, that's not going to be something that we're going to be supportive of. However, this is where it comes down to choices. If, for instance, I played hockey growing up, and if in my junior year, senior year, you were to say you can't go play hockey, and I want to play hockey in college, and it's the most important thing to me. As a family, do you make a choice to go to school virtually so you can go to all the hockey tournaments on those weekends? That's a choice. And we appreciate people who are making those choices and saying, look, I've got an AAU tournament that I need to go to this weekend. I fully understand that I'm going to have to quarantine for 14 days after that. And so the club sports is a hot topic in all schools right now. Our stance on this is that would represent a high risk activity simply because of the contact with the number of people that are involved in it. As you look online on the Day Student Facts, it says there's lots of individualized things that you can do, special permissions, things of that sort, but we do need to make sure that that there is full risk mitigation even in those. I put things in this choice is that, and Garth has alluded to our faculty, and so is Dr. Lewis. We are asking a tremendous amount from everybody involved, and it is sacrifice. We do understand that. And so what we really want parents and kids to feel good about is, what is the most important thing to you? If the most important thing is live school, social interactions with your teachers and students, then these are the things that you're going to have to live into. If it's, I need to get seen by these lacrosse coaches this fall, and there's 6 tournaments that I have to go to, then your family needs to make that decision and say, you know what, we're going to be virtual because this is really important. And so I break that down on choices. And so for outside sports, the club team format is not one we're going to be excited about. The individualized ones, yeah, I think those can be done in a really effective way. We are looking at every option. To give you an example, that we're looking at local pools to try to provide a VES only hour, of swimming each days during the week. So those are things that we are going to be working very hard on to try to meet some of these needs. I just know, unfortunately, we're not going to be able to meet all those needs.
Yeah, I just wanted to jump in to Chris and reiterate, this is why our academic program is designed the way it is, so families can choose, if they need to have their students work virtually for 2 weeks, 3 weeks, whatever they need, and students will not fall behind. They'll still have great connections with their teachers, and all students, whether on campus or off, will remain on the same page because of the structure we have. And I was just thinking, as you were talking, there are boarding schools out there whose niche is providing this kind of education for students who are specialized athletes and need to go down to Florida for the winter season, so there's certainly not the same thing, right? Because that's, we're hoping to do the club sports we always did, but it's a specialized time, and the risks involved make us need to think of it that way. But we'll have that education there for students who, just like Chris said, deem those activities as being a top priority for them.
Thanks for jumping in, Mimi. While you're there, there are a couple of other questions about the school day and how things are going to look. So one of them is, what will outside classes look like? And, what's the actual format, tents, tables, chairs, those types of things? And how many classes will be outside?
Mimi, do you want me to? My mantra would be, outside is going to be safer. So we want to have as many classes outside as possible. There are certain classes that won't be able to do that at times, given the needs for equipment and things like that, but our teachers are extremely creative in doing that. Classroom space outside is literally, it's not tables and chairs, it's chairs or big, more comfortable chairs with the availability of workspaces on those Adirondack chairs. Kids love working at those. And so those will be in a physically distanced way. Some of those classroom spaces, I think we have about 20 of them around campus, will have protection from the sun and from light rain. You don't go hang out under a tent in a thunderstorm. We're obviously going to have weather things that push us in, although I've been guaranteed that the weather is going to be just incredible all fall. And so that's sort of the structure of it. How many classes? Ideally, whenever it's possible to go outside, we want you to go outside. We have invested tremendously in our internet capabilities. So each one of these spaces, except for Charles Watson, because he specifically said he does not want internet in his space, he did in a refined way, have enhanced internet. And that's something that we've been working on all summer to make sure those spaces, both kids can team in if they need to using Microsoft Teams. Each class will have that. And the students will all have internet access in those spaces. So those are just a little bit on that. And certainly Mimi can talk a little bit more about the nature of class.
Yeah, and there's a related question that popped up about cameras again. And I think what Chris just said speaks to the fact that when our students are here on campus in their in-person classes, we want to be out of the classroom as much as we can. And we want them working in groups and doing hands-on activities that aren't as conducive to 360 cameras as a lecture might be. So our faculty are building out their classes through the on-campus platform with all the content available right there. Our teachers will really not be lecturing or conveying content, or they're not going to be history teachers won't be giving their big lecture about the American Revolution during that live in class time. That will be presented via a video they have created and posted on their on-campus page, or some other reading. So the content will be there for them on the on-campus page, and the in-person time will be about discussions and working together in groups and going for a walk out in the woods to look at the trees that you just read an article about or saw a video discussing. So that's why that focus on cameras is not best suited for the approach that we have here and the way we are using that time. It definitely, for larger lecture situations, does make a lot of sense. It can make sense for those schools that don't have the luxury of space that we have and have to bring students back in A and B cohorts. Some students are here on Monday and Wednesday, another on Tuesday and Thursday. Some of those classes are simulcasting in that way. But that's not the approach we're taking. So we feel really confident using, referencing best practices, and all the resources we have, that the approach we're using is what's best for our students and our faculty.
And I apologize if you just spoke to this, but what's the expectation for faculty in posting their lectures so that students can adequately prepare for the next class period that they have with that teacher?
I'm sorry, I got distracted by the questions in the comments. Can you reiterate that, Kathy?
Yeah, so you were talking about virtual learning and some of the pieces that go with that. One of the questions is, when will lectures be posted by the faculty?
Right, great question. By Monday morning at the latest. I think we will gear towards Sunday evening. So the student will see the content for the whole week at the beginning of the week. But teachers will set deadlines within that span of time. So it's not, certainly wouldn't be that everything is due at the end, but all the content will be available at the start of the week.
Okay, thank you. And then Mimi, going back, or Darko, if you could put that period, the daily chart up. Mimi, if you could address when students come back and they have a free period, the specific question was, what if they have a free period on the first day? What if that very first class is free? When should they come? So Amy, you may want to chime in on that, but you talked earlier, Mimi, and maybe you can start to say what students can do, day students can do, if in fact they have a free period or a proctored study hall. If you could talk through that, that'd be helpful.
I think Amy or Chris might be the best ones to speak to that, because it's about arrival times.
I can very, very quickly. So we are not going to change the rule that we've had in the past, that if you have first period study hall, you can arrive for second period. We ask that you do that. You have to go to front jet. You may not pass go. Anytime any student comes to this campus, day student, you leave for an appointment and you come back, you absolutely have to check in at front jet if you don't do the morning check-in. Okay, and there will be the temperature scanners there, and there will be a person there to meet you. That has to happen. We say it to boarders: what signs in must sign out. We need to say it to you as well. You always must sign into campus, and that sign in is a health check. But you can come for the, you can come to second period with that and have the sleep in. I will say, if you have learning resources, you do not have a sleep in, you have learning resources. But if you have a regular study hall in that time, you can arrive to school late. Amy, I hope I didn't misrepresent that.
Okay, and that is true on the first day as well. So your student would not need to be there on the very first day in a period if that was a free period for them, but they do need to check in with plenty of time at Front Jet so they can get to their next class.
Just real quick on that, Catherine, just one thing. If any of you have ever watched the day students move from the day student parking lots to classes, usually around 8:55 for a 9 o'clock start or 8:29 for an 8:30 start, there's a mass movement of people. That is something that we are going to have to break down, and that's why we've got to get people to come here so we're not backed up. Although the temperature scanners that we are getting are very good, very fast, very efficient. So we're trying to avoid that.
I would say as a rule, get there 15 minutes before the
Yes.
start of that period, just to take into consideration the health screen. It will be Margaret Lyle at Front Jet if you come in late. So that's going to be a conversation, a lovely Sunday conversation. So come in 15 minutes before the start of second period if you have first period free.
Great. I'm going to get into some nitty-gritty questions that I have. And I may just run through a few of them quickly, but I'll throw them to folks if I need some additional input. One parent is eager, or a student eager, to buy some Bishop t-shirts. And we have those t-shirts available in the bookstore. The best way to go about getting your t-shirt ahead of time is to contact Casey Williams, who runs the bookstore. You can email her at cwilliams@ves.org, or look her up in the directory, which is online. And we would love to have you purchase some of those fun things ahead of time. You also will be able, of course, to do that once students are on campus. Regarding the health and safety kit, should the day students bring them on their first day of school or at orientation? We were talking about this a little bit earlier. We've asked day students to purchase a plastic bin. I think of, at Walmart or Target, the really heavy plastic tubs, something that they can keep items like their safety kit or a book that they may not need till later in the day. But that is a place for anything that's not of great value. And they'll be able to keep those safe during the day, but also access them during a break. So what I would suggest, particularly with the masks, is always have an extra in that tub, because they may find that somewhere during the day they want to swap masks. And so make sure they don't need to bring 8, but definitely have 1 or 2 extras. And then, should the students keep their supply of masks at home? I would keep the majority at home.
Yeah, hey, Catherine, one quick thing. That the tub concept is if they want to have a place to put some random items, because we're not going to be using the DSL. Currently, our plan is to house most of that stuff in the mezzanine in the gym. That's the plan there. So there's a whole list, I think, I'm pretty sure we added it, of other things they might want to bring: sunblock, hats, things like that. I think are also great for that tub.
I'm glad you mentioned that. So there is a new list of things that you will want to consider bringing. Again, if classes are outdoors, sunblock is really important. So take a look at that list. And another interesting one that has been added is for all students in language classes. There are, as you've probably started to see, masks that have a clear front to the mask. And the language teachers have requested that each student have at least 1 of those masks. So please take a look at that list. When it gets colder, Chris or Amy, in terms of dress code, what kind of jacket is appropriate dress for business casual, and is fleece okay?
Yes, Felice, it's okay. Being warm is what's appropriate. So we're just going to go with warmth.
Great.
Good
All right.
question, though.
All right. And what kind of binders do teachers prefer our students have? Open 3-ring, zippered, closable, does it matter? It's what the student prefers.
I think it's what the student prefers.
Yeah.
Or what the teacher requests. They're available at the bookstore, but usually teachers will post on campus their supply lists, like things you need to bring to class every day. And so I'm sure that that'll be on campus in each one of those classes.
Right. And then one more about sports. What about the gym being opened for, say, basketball practice, whether individually or in limited numbers?
Yeah, so that's a great question. Yes, we will be utilizing the gym, for indoor sports. Mr. Sedlar has gone through many of the different protocols. Our athletic department and the state sports medicine team has been coming up with best practices for all of VES sports, and there will be a set of protocols for each sport and how they are going to do that effectively. It also may change as we evolve through the year. Again, that open well versus the stay open well planning will certainly change that. But physical distancing and those things are going to be important, and there will be, I'm sure, a base, really looking at individual skills, but there are best practices out there, and I know our coaching staff and our athletic department are on top of those.
Great.
Just with that, there's another athletic question about if there's bad weather, will sports be canceled? Yes. We do not have the indoor capacity to have every activity that we offer in the fall inside. And so in a bad weather day, we would likely send students home without that athletic.
And if there are times where boarders cannot be in their dorms, where on campus do we anticipate those boarders being? So from a parent who may consider having their day student shift to boarding, what's the expectation there?
So the dorms will be closed during the day. So boarding students will have access, all the students will have access to the resource that shows them during each class period during the day which ones are open and which ones are occupied by a class. So kids will always, just like a complicated schedule is more difficult for the adults to figure out for some reason, kids can figure it out just like that. In this situation, we will have maximum occupancy signs on every single space on campus. The kids will very quickly figure out, and we'll have it posted for them on an electronic resource and posted around campus. During this period, these are the empty classrooms should you want to go study. You could go over there under a tent and study. You could go to learning resources if that's a possible opening. You would work that out with learning resources. They'll all be able to find out where the open spaces are.
Great. And will boarders be assigned seats just as day students are being assigned?
Yes, absolutely.
Again, for the contact tracing.
Mm-hmm. Yep.
What about if they're in lounges?
Yeah, in lounge, Amy, I'll speak to that. It is essential that we do the seating chart from a contact tracing perspective. The rule the VDH uses 10 to 15 minutes. I think it's 15 minutes within that 6 feet of, the physical distancing would automatically put you into quarantine, which is one of the reasons why we are extending our spacing, but it also tells us who would be within that immediate circle, because if you were sitting for your class, it would put you in that contact trace window. And so we have to be very vigilant about knowing where kids are sitting during those long periods that they would be in that closer contact.
Mm-hmm. So we have gone through all of the questions that have been posed, both before and during, And Mimi,
There's
yeah.
one you missed that I thought was really good. I'm so sorry to interrupt. I know we're over.
No.
But someone asked about the amount of homework related to this new structure, and that's such a good question. And I think this is another piece that will help everyone make sense of how this will work. So teachers aren't thinking just in terms of classwork assignments and homework assignments. It's the amount of work total per week. So again, by Monday morning, students will be able to see all of their work for the week. And while teachers may have set up some specific deadlines, you know, maybe this is due on Thursday, that is due on Tuesday, things won't be broken down so specifically into classwork and homework. It'll be 5 hours, 5.5 hours of work total for the week for this class. And teachers will be putting timestamps, estimated amount of time that each assignment or video or reading will likely take those students. So it is going to be, I think, very cool and very effective. I know our learning resources teachers are quite excited about the way students will be able to take control of their learning and when they do which assignments through this model. And there will absolutely be a learning curve. Teachers at the end of the week will be asking students how accurate their assessments of how long each assignment would take actually were. So for every class on Friday, you know, were Ms. Chetlosh's estimated times right on the money? Did you finish faster or did it take longer? And we will be adjusting according to that. So we're really thinking in terms of week-long blocks. And I will, what is it today? I don't even know what day it is, but I'm very soon gonna make some videos for you that show an on-campus page set up this way. And I think once you see that, it'll make a lot more sense.
We also have a question about, you know, the Q&A that's online, and it may feel a little tedious to, you know, to click the plus sign and see what's below. I think one of the challenging things that I'll share with you is we are creating new information, new dates, new ideas literally every day. So to, you know, print that out and share it in a different fashion would be very difficult in terms of versioning. I think, you know, somebody might see a version that had less information than we intended for them to have. So I apologize if that's a challenging way to look at the material. Because we made so many updates yesterday on the website, we did not mark every single section that was new. Almost everything was touched with some slight change or new information. So I would just really appreciate you know, you're spending the time going through it, familiarizing yourselves, and hopefully the new information will start to slow down, and we will mark, the intent is to mark sort of by date the chunks that are added as we go forward from here. Let me see if there's any other.
There was one, Catherine, about how will day students eat lunch? And I know Amy's talked about the cadre system, day students will eat with day students. But the way the dining hall is going to start, it will be grab and go for the open well period. So that first 2 weeks, in other words, there'll be a selection. Students will come in, they will hand sanitize, they will be in mass. They will go in a physically distanced, there's marks on the ground. Meriwether Godsey has got this one. They will come through, pick up, and then there will be seating. And the seating, again, please don't move the furniture, with a number of chairs at physically distanced area. Plus there will be a 40 by 60 tent outside of the dining hall with 8-foot long tables that would have 2 people per table, 1 at each end in a distance way. So students will have a little bit of flexibility whether eating inside or outside. But our hope is in the dining hall's hope is we can get to a service model as the year progresses, but we're going to start with the grab and go and then move away from that. Obviously, vegetarian, dietary restrictions, all those things are going to be taken into account. And so it's Meriwether Godsey food, which my 26 years in institutions, this is the best food I've ever eaten at a boarding school, and they are excited to get back at it and to feed both our students or families. So you know that only students and faculty will be allowed in the dining hall this fall. In other words, faculty families and faculty children, they will be in a grab and go situation, but not in the dining hall. So it's, again, mitigating risk. And that's a hard one. Is folks, like, that's one of the joys of boarding school, is seeing, faculty kids just running around, running amok. That's another place where we've asked faculty to say, hey, look, this is one of those restrictions that we're going to have to put into place for you. So, and ultimately, it's for the good of the whole community.
Fantastic. Anyone have a wrap that you would like to share?
Yeah, I would. And I think one of the questions that no one is asking is, like, what does Garth do all day? And there's an incredible team here. And I think you heard Chris Lewis say it. We haven't thought of everything, or they haven't thought of everything, but they've thought of almost everything. And, my job is to make sure when Chris or Mimi says we need something, to make sure we can get it. And the board has been incredibly supportive of that. And so we really feel like we've put our resources to work this summer to make sure we can open well. And I feel so lucky to come into this situation where I can trust that Chris, Amy, Mimi, Jen, Catherine, Justine, everybody has been working so hard to try to make this work. And I just, we don't have it all figured out. I thought Chris's comment that it's a partnership, and it's going to continue to be a partnership between us and you. And I hope that's the way VES always will be. But just trust that we are doing the best we can, and we have tried to think of everything. And we really, really feel that opening with students on campus is important for what we do at VES. So we can't wait to get to September 7th. Thank you for all you're willing to do to support us in this effort. Thank you for all the restrictions that you're going to live through. But I think it's going to be to everybody's benefit. So thanks.
Great. Thank you, Garth, and good night.